Tired of suffering from knee pain? Discover the secrets to quick relief. This is Dr. Petropoli, otherwise known as Dr. P. If you have a problem with your knee, call Dr. P. So today we're going to do a little mailbag session. Y'all write in and you ask great questions. So I grouped together a bunch of questions here where people wanted to talk about home remedies. You know, what can I do at home? What can I do on my own to help my knee pain? And there's a lot of things. And some of these things you wrote in on asking me questions about. So one of them is like, what type of home exercises and stretches can I do to help my knee pain? Well, first of all, a lot of people will go to physical therapy, and I do advise going to see a professional. I'm a big proponent of going to a physical therapist, so ask your doctor to prescribe physical therapy. But you don't have to go to physical therapy 5 days a week. It's not like a 24/7 thing. You're going to go, and if it's not a major issue, they are going to give you some exercises to do, and they're going to give you some stretches to do. The key is you got to do them. The most common complaint I see coming from a physical therapist is that the patient didn't do their home exercise program. So they feel that it's so important that you do them, you should do them. So I would say sometimes we'll even just prescribe 1 or 2 physical therapy visits. The patient will get their exercises to do on their own. And if they're motivated, they're gonna do them on their own. So I would recommend that versus just giving you some generic stretches to do if we don't know what your problem is. I can't diagnose you over a video. So get your primary care doctor to get your prescription, either to see an orthopedic surgeon or to get into a physical therapist, and they can get you the exercises, the proper ones to do, because I think that's more important than just trying to figure it out on your own. So that was one question about what exercises and stretches can be done. Another, should I rest or should I be active? That's a hard one to answer because it depends on what the injury is. But in general, if it's not a fracture or a major injury, some movement is good. We don't want to get stiff. Movement is always a good thing, but again, if you've had an injury or something like that, I would get into a professional first, whether it's your primary care doctor, an orthopedic surgeon, or a lot of physical therapy offices. You can go direct access right into physical therapy and they can see you. So in general, I'm not the biggest fan of rest just for the sake of resting. There's always something that can be being done while you're kind of, quote, actively resting, we call it. So doing nothing usually causes the body to kind of atrophy and get weaker. So that's why I'm still a huge proponent of physical therapy, exercises, and keep moving, get moving. Over-the-counter remedies was another question. And so there's a whole host of those things. There's obviously your traditional anti-inflammatory medications like Motrin, which is ibuprofen. Aleve is naproxen. Advil is also ibuprofen. So there's generic names and then there's brand names. But the bottom line is an anti-inflammatory, non-steroidal anti-inflammatory, an NSAID. That is something you can buy over the counter. But number one, I highly advise you read the label or talk to your pharmacist, especially if you're on other medications. But again, I think the point of this is talk to your primary care doctor first and say, hey, I'm having this issue. Is it okay if I take Advil, Aleve, whatever the over-the-counter medication is, and they'll advise you if it's okay, and then obviously follow the directions. Some general guidelines to taking non-steroidal anti-inflammatories are that these are medications that can decrease inflammation, which causes pain and swelling, and decrease pain itself. However, when you take them, it usually is advisable to take them with food because they are known to potentially cause irritation of the stomach, especially if you take it for too long or you've had an ulcer or something like that. Again, I can't stress enough, ask your primary care doctor who knows you the best what would be best to take and if you can take it. But yeah, those can be fairly effective. I'm not a big fan of using those long term, but for short term use, those can be very effective. Tylenol is not an anti-inflammatory, it's a straight pain medication. Acetaminophen is the generic name. That is, again, something that's usually very, very safe, but if you have liver disease or other types of chronic problems or you're on certain medications, they can interact. So again, your pharmacist is going to help you with that, also your primary care doctor. But in general, Tylenol is very safe because it's not going to irritate your stomach like non-steroidal anti-inflammatories can do. So those are simple things that I think we've all taken, but I think we sometimes forget. Always check with your primary care doctor to make sure that there's not going to be an interaction or your medical condition would preclude taking that type of medication. Now, those are the ones you take by mouth. There's tons of different creams and gels and lotions out there as well. Voltaren is a very common one. Voltaren cream or gel, that is an anti-inflammatory. Now, when you rub it on your knee a little bit, for instance, if it's your knee or your elbow, if you got tennis elbow or whatever, some of it is going to get into your system, but not a lot. So it's got a lot less chance of causing an ulcer or problems with blood pressure or any of the millions of little complication things that you see on the back of any medication bottle that are usually very rare, but hey, those things can happen. They're there for a reason. So again, talking to your primary care before you do any of that. But in general, the creams and rubs tend to be a bit more safe for that regard. And, they're kind of oily and greasy and they can stain your clothes and things like that. So there's advantages and disadvantages to using them. One nice advantage is it's not going to go through your whole system. It's just going to go into the area most of the time where the problem is. There's lidocaine, which is a numbing medication. It doesn't do anything other than kind of numb the skin nerves up, and that will help kind of distract the pain or help numb it a little bit. But that's really not treating the underlying problem. And none of these are really usually treating the underlying problem. That's why I'm a big fan of things like PRP, platelet-rich plasma, bone marrow cells, BMAC, laser, things that are going to help treat the underlying problem, but you're not going to be able to do those on your own at home. And a lot of times, if this is a minor thing, hopefully we can get you through it just by doing these types of things at home. Lately, there's been a lot of CBD creams and things like that coming through. Those are really more almost like a supplement. They're not prescribed by a doctor, so you never really 100% know what you're getting. I mean, I would speak to your pharmacist and ask them what they think the best brand is. That goes for other supplements like glucosamine chondroitin sulfate. We've talked about that in some other videos. That's basically the stuff that your cartilage is made out of. So by eating it, supposedly it grows back new cartilage. I don't think anybody's ever proven that in humans, but there is some evidence that it may protect the cartilage you have left. And there are people who take it who feel as though it helps their pain. It's not a miracle cure, but any of these supplements, always check with your primary care because they can interact with the medications you're on and vice versa as well. And then, the pharmacist can help you with that stuff as well. What about simple ice or heat? So the general, because people ask me that all the time, when should I use ice? When should I use heat? So the simple kind of rule there is if it's an acute injury, meaning it just occurred within the last, 3 days for sure, but even, a week or two, ice is usually going to be a bit better because ice is an anti-inflammatory, okay? And it decreases swelling and inflammation. If you get the swelling down and the inflammation down, the pain's going to improve. So the one thing about ice is, though, you don't want to fall asleep with an ice pack on your leg. I just saw a guy a few minutes ago and he actually had blisters on his leg because he did that. So if you're putting an ice pack on, usually you want to put a thin towel or something between the skin and the ice pack, and then you don't want to leave the ice pack on for any more than 20 minutes. These are general rules. Again, get in to see somebody if you're not getting better after a few days. But ice tends to work better initially. Heat tends to work better later on. So after a minimum of 3 days, but you get a week or two into this injury and it's healing, sometimes heat works better. It loosens it up. It also increases blood flow into the area. You need blood flow to help with healing. So heat does work well that way. Same thing like ice or heat after exercise. Well, you want to heat before because that'll loosen things up, get the blood flowing, make you more pliable, more stretchable. You don't want to tear things or sprain things. And then ice afterwards because ice will decrease swelling and inflammation, and it will somewhat preventively lessen your pain that you experience the next day after a hard exercise session. So that's kind of the general rule with ice and heat. Same thing with heating pads. You don't want to fall asleep with a heating pad. I've seen people burn themselves. So there are heating pads that have timers on them, and I would recommend that. Always follow directions on the, on the box because they're all a little bit different. Here's another big one, knee brace. What knee brace should I choose? There's difference between a brace, an actual brace, because there's like an instability, like a torn ligament or an unstable knee, and like a knee sleeve. So you hear about Copper Fit is probably the biggest brand name one, but there's a lot of them out there. A lot of people like just to have a knee sleeve on because A, it keeps their knee a little bit warmer, and sometimes that makes it more flexible and it feels better. And B, it gives what we call a proprioceptive effect, meaning it just gives this sensation that there's something there helping stabilize it. I mean, honestly, none of those things, those sleeves, are going to do anything for stability if you have a torn ligament. They're not rigid enough. They're not going to provide that, but they might provide a little compression if you have swelling. They might provide some warmth, and they might provide some security, even if it's mental security. A lot of people swear by them. Now the copper, I think there is a little bit of evidence that copper can have some, anti-inflammatory or some healing response to it, maybe even slightly increased blood flow, but it's not definitive. And I mean, I think copper or silver or those things, they're actually better for keeping the germs away from it and maybe making it not stink so much. Silver especially. So I don't think there's anything magic about any of those. Some people like them, some people don't. Now, if there is an actual tear of a ligament, like the MCL, which is the ligament along the inner side of the knee, or the ACL, that's the big one in the center of the knee, then that usually needs a brace that's going to be prescribed by a medical professional, because they're going to have to prescribe the right one. So if your knee's unstable, don't just buy any old brace. I see patients come in all the time and they bought like 3 or 4 braces and none of them are the right one that they should have had in the first place. So if they just had come in, we would have prescribed the correct brace in the first place. So most primary cares aren't necessarily going to know what brace to prescribe, but they might. Orthopedic surgeons are certainly going to know, and physical therapists are usually very good with knowing what the right type of brace is. And then there actually are orthotists or bracing experts out there who can also do that type of stuff. I mean, the only other thing I would say is, people want to know when they should actually seek medical attention. And if you have a fracture or you have a major injury, you're usually going to know and you're going to get right in. That's just the fact. But a lot of these are weekend warrior type things, and people don't know exactly when they should go see their doctor. I would say it's going to be normal to be sore for a couple, 3 days after playing flag football in the fall. If you haven't played forever, you're going to be sore for a few days, or if you haven't run in months, you might be sore for a few days. But if it starts going longer than 3 days, 4 days, or it's getting worse instead of getting better, then you should seek medical attention. So I hope that helped. I mean, there's a lot of probably even more things we can do with home remedies, but I hope I helped you decide when you can kind of treat it on your own and when you need to seek help. And again, only your own doctor knows your health better than anybody else. So always contact or consult with them first if you have any more specific questions. And I hope this was helpful, and please, keep the questions coming in, the comments. That's how we get a lot of our content. And remember, if you got a problem with your knee, call Dr. P.